I'd like to welcome everyone to Breaking It Down. Frank MacKay here. So much more importantly, Carolyn M. Rubin, healthcare professional, and she knows more about the healthcare industry and insurance and everything else that you could imagine. We've been doing a series. This is the final episode in the series, and she's been absolutely terrific and absolutely patient. I just hung up the phone with Captain Keith Colburn. His name is. He's the star of The Deadliest Catch. It's a TV show, some kind of reality show, and he was calling from a hospital bed. And the thing with him is he just got COVID. His show just started. Been on for years and years. They catch king crabs. I've never actually seen it, but don't tell him that, right? But he scheduled, or somebody scheduled an interview for him for the radio show, and he's in a bed, and he's in a hospital bed in Central America, and he said it's completely different than everywhere else. He's got tubes sticking out of his nose and everything. It was just a crazy occurrence. But what his message is, this is Captain Keith Colburn. He's the star of this very popular, wildly popular show, Deadliest Catch on Discovery Channel, is that COVID is real. And a lot of the guys that follow his show, a lot of the people who he's friendly with are still saying, this isn't real, this is a game, this is nonsense, or whatever. But the bottom line is he's got tubes in his nose. He's going to make it. It sounds like he's going to make it, but it didn't sound like he was going to make it a couple of days ago. So they rushed to do this interview. You were very patient with me. My apologies. But Carolyn Rubin, how are you?
I'm good. How are you, Frank?
Well, what's your reaction to that? I mean, first of all, being out of the country and having a situation where, maybe you're working out of the country, maybe something else. And he said they don't have the medicine that we have here. What's your reaction? Do you get a lot of this?
Yeah, there's a lot that of the countries that are, they're looking for that vaccine, right? They don't have it. They're asking for it. They're wanting to get the vaccine that we have here. They're asking that it be shipped. I mean, some of them have it, but not very many. They're not to the extent that we have it. And it doesn't surprise me. I mean, COVID it's real. It is real. We all know it's real. There's countries that are still shut down, they've tried to come back and they've had to shut back down again. Look at England. I mean, they're shut back down again. It's not not anything we should be taking lightly at all.
Yeah, it's amazing that we have to do this. We have to give this message that it's real. I mean, why wouldn't we think it's real? I would think the message now and the fear now would be that it's still real. Not that it's real. I think it's like 3 million people have passed away because of this. Obviously, it's real and whatever, but that it's still a risk. Maybe we're letting our guard down a little. Maybe some of that because we have the vaccine. You are vaccinated. I'm vaccinated. We're 3 weeks out or 2 weeks. Past 2 weeks out.
Right.
Maybe it's more of that than anything else. Do you see that happening around the country?
Oh, absolutely. I mean, I think definitely people are letting their guard down, but I think there's still, a lot of us that are keeping our guard up, still wearing our masks, still social distancing. Businesses are still requiring masks. They're still requiring social distancing. While a lot of them are opening back up, they're putting the 75% to 100% at restaurants, depending on which state you live in. They're still trying to be cautious. They're still trying to be conscientious of the fact that virus is still out there. It is still real, but they're wanting to open the churches back up. They're wanting to get people back into the schools, back into reality. But we have to be careful. I mean, we have to really, take a step back at times and see what's really going on around us. Every state is still different at this point, but more and more states are opening. Seattle, which is where my stepson lives, they started to open it back up. And then in Tacoma, where he's at, they're having to start to shut it back down a little bit because the counts are going back up. So, they're at least paying attention, but we'll see how long they do that.
I keep asking you this because you are from Texas. Texas did away with the mask, but again, fortunately, still when you go to restaurants and when you go to any kind of medical facilities, you have to have the mask on. So I guess it mainly applies to things that are outside. Is there an uptick in Texas since the mask has been torn off, so to speak?
There is a little bit, yeah. So depending on where you're at, depending on what's going on, as far as what region you're in, there is an uptick in the cases. We've seen that. It's not to the level yet where they're having to shut things back down. But if it does hit a certain level, if the ICU beds get to a certain point, then they will have to start shutting some things down again, as far as the sports venues or some of the restaurants and things. But at least it's not to that degree in most areas. But people are still being diligent. Like I said, the businesses are still requiring the mask, the social distancing is still in place. But the outside sports venues are starting to open back up though. And while they're requiring the mask and they're requiring that, people social distance to a degree, they've opened those ticket sales back up, I think a little bit more than what they should. But, that's me. I'm more on the safety. Let's be a little bit more cautious, but, they're,
it is a global pandemic, it's,
yeah, it is.
let's take it seriously. Again, we started off me being late and talking to some guy from a hospital bed in Central America.
Yeah.
I said, what country are you in? And he said, well, I don't want to throw anybody under the bus, because they've been so helpful. And he said, I'm so grateful to where I am. But it's Central America, and he said all the countries are great. He said there's second world countries and there's third world countries. And he said, it's just different. It's not like being in America.
No, it's not. I mean, they just don't have the resources. They really don't. They don't have the resources that we have. And again, they don't have the vaccines that we have. So, they're asking for those vaccines. They're asking for, our help to get people vaccinated and to be able to treat people. I mean, we've just seen too much of it. But now we've got the other strain that's coming out, and it's getting, more and more, and they're talking about, should we have a third dose, on the vaccines that we've had. And I'm sure we're going to need that. It's going to be like the flu vaccine. We're going to need those boosters every year, right? Just to make sure that we don't end up, subject to getting that virus somewhere down the road.
Where do we stand as far as a country, as opposed to the way we're handling it now, as opposed to other countries? Are we towards the top? Are we doing well as far as response goes?
I think compared to most, I think we're probably kind of right in the middle as far as that is concerned. There's still several of the countries that are still more cautious than we are. They're still closed down. They're still making sure that, they're taking care of everyone, and that they're really, making sure that this virus is kept contained. They're being a little bit more aware than what we are, I think, at times with the different strains that are out there. But, we're trying to open the economy back up. We're trying to make sure that, people can go on living and they can get their kids back in school. So I think it kind of goes both directions, right? So I think it just depends on which way you want to look at it, from both the economic standpoint, as well as the healthcare standpoint. So, you've got several things that are happening all over the country and all over the world. So just to make sure that we're all looking at it, and trying to stay, healthy, but also stay financially sound.
Is that the biggest issue as far as conflict goes? Is it economic versus the health and safety? For the most part, I would think it would be. I mean, that's what the biggest concern is. Do we open up and hopefully improve the economy, but at the same time risk putting us in further trouble, which, by the way, would not be good for the economy either?
Exactly. Well, and I think if you do it smart, you can accomplish both, right? So, and that's what the businesses are trying to do. They're trying to figure out, how can we reopen our business, take care of our patrons so that we can stay open at least 75 to 80% to full capacity, not put our patrons at risk health-wise, but, start getting to the point where, the business itself can become more financially sound. So, we have all of these small businesses that are just, they've been struggling for over a year. Can they keep their doors open? Do they keep their doors open? They're finally starting to be able to bring their staff back and be able to employ them again, get them off of unemployment, get them back into working. They don't want to have to lay them off again. That's the last thing that they want to do. So they know they have to be smart about how they do things. This last weekend, we went out for breakfast, and, the place where we always go, it was actually very busy this weekend compared to how it's been over the last several weekends, but they're still being very smart. Everybody has to social distance. If you're, they put you on a waiting list, you're waiting outside, you're not all crammed into the entryway waiting for a table to free up. Everyone has to keep their mask on unless they're eating or drinking. And as soon as they're done eating, it's not like they just sit around the table and talk. They're having to, if they're going to sit around to talk, they have to put their mask back on. Otherwise, they're checking out and they're leaving. So they're being very smart about how they run their business, so they're at about 80% full. But they're keeping enough space between everybody to where it's safe for everyone. And all of the wait staff, they all have masks on. Everyone had masks on. So they're trying to get their businesses back established, get them back open, keep everybody safe. So it's good to see that, and it's good to see that they're still, at least trying to keep the CDC guidelines in play.
Yeah, well, listen, it's so important. And again, we're not out of the woods yet. We're getting there. There's light at the end of the tunnel. But I mean, for us to let our guard down now would be so foolish. We've sacrificed so much, and to just say, oh, we're done sacrificing, let's just get back to it, and then put ourselves into a worse situation.
Yeah.
But the strands, you mentioned the other strands. Is it something that you're watching and that the industry, the medical industry, well, obviously they're watching it very closely,
right.
But is there one in particular that is disconcerting?
I don't think there's one in particular. I think they're just paying attention to all of them. I mean, I think for the most part, they think that, the vaccines that we currently have, will capture those different strains, but there's new ones that are popping up at different times, so where they think that they've gotten them, all accounted for, then all of a sudden here comes another one. So it's trying to identify what all of these different strains are about, and then just tracking what those differences might be, and then trying to figure out, are we going to need a booster somewhere down the road? Or will the vaccine that we currently have go ahead and take care of, the different strains, as well as the original COVID-19? So I think it's just keeping that in perspective as we continue to go day to day with our lives.
Do we have? I know there's updates every day, but are we still roughly about 3 million a day coming in? Is it more than that? Is it less than that? Roughly, how many people are getting inoculated a day?
I haven't heard the latest number, Frank. I actually need to go out there and look at that, but I know that they've done a great job getting shots in arms. They've had to pull the Johnson & Johnson for a little while, but getting Moderna and Pfizer out there, they've done a great job being able to get those into people. Anybody who wants the vaccine anyway has been able to get that vaccine. So I think as soon as they get the testing with Johnson & Johnson, get some more of that, data reviewed, I think we'll get that back out. They were looking and talking about that this weekend. I mean, the number of individuals who actually had those side effects with the blood clots were, very minimal compared to the number of individuals who actually received the Johnson & Johnson. So hopefully we see that back out on the market pretty quickly, so that way we can continue to get that vaccine into individuals as well.
I know a lot of people that are anti vax, which I don't understand for the life of me, but yeah, these anti-vaxxers use the situation with Johnson & Johnson as a method of saying, look how bad the vaccine is, look how bad the government is acting, whatever. I saw it in a much different way. I saw it as, hey, the government is so competent at this point. And again, maybe I'm Pollyanna, right? But the government is handling this so well that they pulled one of the 3 vaccines off because it wasn't. And again, if you're the person who died, or you have a loved one who died, one death is too many. But under the circumstances, we're in a global pandemic. Under the circumstances, the fact that they pulled the Johnson & Johnson was very impressive to me, that they're not taking anything for granted. I saw it as a gold star moment where they deserved a gold star on what they did and the diligence they did. I don't know if you agree with me, but I for all of those naysayers out there, shame on you. I think it showed tremendous confidence on our behalf, our meaning the U.S. Behalf.
Yeah. Yeah, no, I totally agree. I mean, if anything, it should put everybody at ease, the fact that they totally took that seriously and pulled it to really do the research and figure out, okay, what was the reason behind those individuals who ended up with those blood clots? Was there, what were the comorbidities that those individuals had? What was the instances behind them? So they could make sure that those types of individuals did not receive that vaccine moving forward when they did roll the vaccine back out again. So no, absolutely, they deserve a gold star for, making sure that they keep people safe moving forward. So it may not have been that many people out of the millions that received the vaccine, but the fact that they took that seriously enough to look at it was definitely a gold star.
The same way you're going to look at the numbers, I'm going to look at the numbers too, of how many people are getting it. But keep in mind, I'm talking to listeners here, but keep in mind, when you see numbers go down, that's a good sign. That's because people have already gotten it, and we're running out of people that are getting it or that are willing to get it. It's a bad sign that there are people that aren't willing to get it. I don't know what percentage, but I told you there was a law enforcement community near where I live where 40% of the crew has refused to get it, and that's very, very disappointing. What's standing out to you as far as the anti-vaxxers or the folks that are saying even wait, right? Because there are people that are saying, I'm not an anti-vaxxer, but wait, let's wait it out. To me, there's tremendous risk to wait.
Yeah, there really is. I mean, it's a matter of just getting it done. Be safe around your family, be safe around your loved ones or friends, or even just other individuals. There's really no reason to wait to get it. Nothing's really going to change. There's more and more different versions of this virus that's coming about. They're trying to get people back to work, instead of working virtually, they're trying to get people back into an office. In a lot of situations, they're trying to get kids back into school. They're trying to get colleges reopened, businesses reopened. There's really no reason to wait. It's take the vaccine, just get it done, and continue to wear your mask and social distance, but, just stay safe.
Yeah, no question. I don't see any benefit in waiting, but I guess that's the third option. There are those who are saying, no way. There are some like myself, please get it to us right away and we'll crawl on broken glass to get it. And then I guess this is the third option, saying, I'm not saying no, but I'm saying I'm going to wait. And that to me is, they're at risk the whole time they're not inoculated, the whole time that they're not vaccinated. They have a better chance of carrying, they have a better chance of getting, they have a better chance of passing it on to other people and at the highest rate. if I understand this correctly, because I got the Pfizer, because of that, if I were to get it, if I were to get COVID, that my condition would have a 95% chance of being less extreme, and I have 95% less chance, or whatever the number is, of contracting it in the first place. Is that accurate?
Yeah, it's pretty much. I mean, getting the vaccine gives you about a 95% chance of hopefully not getting it, right? So, and if you do come down with it, your symptoms hopefully are just very, very mild. So it's hopefully keeps you out of the hospital, keeps you down with just very mild symptoms. Maybe it's just flu-like symptoms or cold-like symptoms, or something, if you even get it at all. The goal is that nobody ends up with it, but it's kind of like when you take the flu shot. The goal is that you don't come down with the flu, or if you do come down with the flu, it's very mild symptoms and it's gone within just a day versus several days, and you're not totally ill or hospitalized. Everyone reacts a little bit differently. If they get around it, some may never ever get it. But hopefully if you do end up with it, like I said, it's just very mild symptoms that you're over with it in just a day or two.
We're getting most of the folks in my age group, your age group, we're in the same age group, done, and now they've lowered it, and I imagine all the states at this point have lowered it to 18 and below. What is the cutoff point for the most part? Is it 14? Do they not want people under 16 getting it, so the 15-year-olds and 14-year-olds aren't recommended to get it? What is the general consensus on that?
Yeah, right now what I've heard is 16 and above, but they're looking at the younger than 16, so they're looking at 15 and younger at this point in time. But 16 and older at this point, get the vaccine. Just go get it done. I know that they're looking at the 10 to 15-year-olds right now, especially with sports going on, and getting them into those individuals, if they can get those going, because they're in football, softball, they're looking on all kinds of sports and everything. That's going to be your next population that is really high risk when you start thinking about, those individuals who are in a, really tight spot, and close together. Yeah, anybody that's 16 and above should be getting that vaccination.
Yeah,
in most states.
Yeah, most states. Hopefully we're seeing light at the end of the tunnel. It's obvious that there's light at the end of the tunnel. The next strand, even if it comes, we're much more prepared than we were obviously before this. This just hit us out of left field, and who could have prepared for something like this? I just can't.
Oh yeah.
Yeah, I can't imagine anybody really predicting this properly. Even in the beginning, when people were saying the word pandemic, it didn't pass the giggle test. It was like, oh yeah, pandemic. Oh right, global pandemic. World leaders, unfortunately, weren't taking it seriously, and
no, they weren't.
And terrible that they weren't. I don't think we'll ever be caught with our pants down again, and we'll never be caught with the unpreparedness that we had here. And that's on the governments. That's on the government. But the medical community here in America and elsewhere, gold stars all the way around for all of them, including you, Carolyn and Rubin. You've been great, and all of you, and to all your colleagues, you've absolutely been great. Any closing thoughts as we close this series out? Anything we didn't cover that we should have covered? Is there anything that you'd like to add in closing? Give us a final thought.
I think, final thoughts, I think, is really everybody just needs to stay strong. We just need to continue to stay focused in this, moving forward, and don't let your guard down, even though, we see the illnesses go down. We see the rates come down as far as the illnesses are concerned. You don't hear as much about it. While we continue to still hear about COVID on the news, you don't hear You don't see the ticker tape going across the news anymore. That used to be a daily thing. Everybody could see how many people were ill or how many people we were losing due to COVID. We don't see that anymore. It's not right there in front of you every time you turn the TV on. But people should not lose focus over the fact that it is still an illness that we should all be very concerned with. We should all be very diligent in washing hands, wearing masks, social distance, especially if you have not been vaccinated or you have young children that can't be vaccinated right now that are still going to go to school, could be exposed to somebody whose parents were not vaccinated, and could still bring that home to others. So be careful, just, don't lose sight of it. And help out the businesses that are trying to reopen, be diligent with that, and just take into consideration of the fact that, there's everyone who needs a little bit of support in one way or the other. So, regardless of whether they're in healthcare or just in business, in any type of way, lend a helping hand. And just be thoughtful, be supportive, and just, think about things before, getting into the wrong direction, going into the wrong direction. Wear your mask, social distance.
All the things that we've been hearing all along, they're all true. And if they're becoming cliches, they're becoming cliches because they're true. Carolyn M. Rubin, thank you very much. Yeah. Stay safe, and congratulations on a great grandchild. You're the youngest great-grandmother that I've ever met, and you're the youngest looking for sure. That's absolutely positive. Thank you. I've learned more in the last 6 weeks than from any other source. You're absolutely fantastic. Thank you very much.
Thank you. It's been great being here. Thanks, Frank.
And to everyone out there, Carolyn M. Rubin has been our guest, and please binge watch the series. And if I just will mention that we'll be on 106 different outlets, radio and podcast outlets, as we convert the video to radio and to podcast. So thousands and thousands of more people are going to be able to hear this information. It's terrific. It's terrific because she's terrific. She's an award-winning, and when I say award-winning, she's won every award you can imagine. For her industry, she is just absolutely fantastic. She is respected among her peers and among listeners and everything else. She's absolutely great. Carolyn M. Rubin has been our very special guest. Please, if you haven't watched everything, watch all of them, and you'll be able to listen to all of them and binge listen to all of them as well. Frank MacKay signing off. We'll see you all next time on Breaking It Down.